Are there people who can get special benefits from Medicare? Special populations, people get more than others or even less than others from
If they don't enroll during their open enrollment period, they have to wait for a general enrollment period, which is another time frame during the year that they have to wait for. And so they won't have health coverage during all of that time, and that late enrollment penalty adds up.
So, this is Larry Gray with Legacy Insurance and Financial Services. I'm interviewing some agents who have met with thousands of people about their Medicare and retirement planning, and they have the inside dope on what's going on and how people get stuff done right, how people unstick what's going on. We thought we might get a little insight and spend a little time with Tammy. How you doing, Tammy?
I'm great. Thanks for inviting me.
You're welcome. I'm not sure that thank you was that sincere, but
Well,
and you have, I'm not sure how long you've been here anymore, but you've visited with thousands of Medicare beneficiaries.
yes, I have.
People who are already been on Medicare for a while, people who are new to it, say 64 years old, aging in, and trying to figure it all out. And you've seen all the different scenarios, people with low incomes, people high income, military, and gotten involved in that stuff.
Yes. I've had the opportunity to meet with so many different individuals, like you said, pre-65 and post-65 in all aspects.
So let's start. What do people miss most when they're signing up for Medicare?
Well, what I've found that people miss most is timing. And so understanding when to enroll in Medicare is very important. There is an open window, a 7-month window, in which someone that's turning 65 should enroll in Medicare. Now, that doesn't mean they need to if they're still working and they have credible coverage, and that's something that I go into detail with them. But timing is everything. If they don't enroll in the appropriate time, then they will be assessed a late enrollment penalty, and that is a lifetime penalty, so it's unfortunate, but it happens. Another thing people will miss is they'll think because they don't take prescription drugs, they don't need a prescription drug plan, and so they don't plan for that as well. And if you do not enroll in a prescription drug plan, you'll also be assessed a late enrollment penalty.
So timing. Right?
Timing is everything.
Timing's a lot. Have you seen people that, mistime it and don't get coverage at all?
Yes, absolutely. If they don't enroll during their open enrollment period, they have to wait for a general enrollment period, which is another time frame during the year that they have to wait for. And so they won't have health coverage during all of that time, and that late enrollment penalty adds up.
So they still have original Medicare, right? They have the base Medicare when they turn 65 most of the time, right?
No, Medicare is not automatic. Medicare must be applied for. If they are working, it's not going to just automatically start for them anymore. It used to be a few years ago, but that's recently changed. The only way that Medicare is automatic is if the individual decides to turn on their Social Security retirement. So that's the only thing that will actually kick on a Medicare Parts A and B enrollment. But if they have not done that, it's not automatic. If they are required to enroll in Medicare because they're not working and don't have credible coverage, then yes, that late enrollment penalty will begin to be assessed.
So if they've got their Social Security already turned on, maybe they turned it on at age 62. When they hit age 65, maybe this summer right now they're turning 65, they should have, in fact, already gotten a card in the mail, right? Both A and B, or just B?
Well, it's a little paper card similar to a Social Security card. It is red, white, and blue. It has their name on it. It has Medicare Parts A and Part B effective dates, and it will reflect the first day of the month of their birth. They turn 65. Now, that again is only if they have turned on Social Security retirement income prior to age 65, and that card should arrive about 2 months before their birthday, sometimes 3.
It's a little time, enough time for planning.
Correct.
Right?
Mm-hmm.
A good time in there. Okay, but if they don't turn on their Social Security beforehand, they don't need it. Maybe they're waiting till full retirement age at 66 plus. Then they need to apply.
That's correct. So that's where meeting with a professional, an agent like myself, we can help them make the determination as to, number one, are they still employed? Do they have credible coverage through their employer or their spouse's employer? And do they want to keep it? Sometimes it's ridiculously expensive on the premium side, and so Medicare is actually more affordable than what they're currently paying on the group plan. Their employer
Can
coverage.
be ridiculously expensive.
That's correct.
Yeah, you're certainly not the first person to bring that up.
Okay.
Yeah. Worst age is between age 60 and 65.
Yes.
Right, for whether it's private or employer.
That's correct. And so making that comparison with an agent side by side, looking at the two plans, Medicare versus the group plan that they might be on, it helps them also understand the difference between meeting a deductible and also having no deductible, possibly with Medicare. And so there's a lot of differences there, and maybe not all the coverage that they need through the group plan that they might enjoy through Medicare.
Yeah. So the group plan could be a really rich plan, right? Maybe they pay almost nothing, if at all. And they have maybe a low deductible. What would be a low deductible today? $1,000, a couple $1,000, right?
Sure.
And good employer benefits. And now they have the option. Is there a case where if they have a really attractive employer plan, just get one part, only Part A or Part B, or they don't get it at all, original Medicare at all, or?
Yes, all of those are scenarios. Maybe don't get it at all. Maybe just apply for Part A. Part A is hospital side coverage of Medicare. So, and use it in conjunction or as a combination. Sometimes the group plans might have things that Medicare covers, the group plans might have things they cover that Medicare doesn't. Oftentimes, group plans do not have a donut hole. Some people are familiar with what a donut hole is with prescription drug coverage, and it doesn't exist inside the group plans.
Makes sense. So it depends on their own scenario. It depends on their employer plan.
That's correct.
Now, my understanding is before you become Medicare at age 65 and you're working, you're paying FICA taxes, right? That gets taken out of our pay after year. That FICA, a portion of it, is going to pay people who are currently on Social Security and Medicare. So we're not receiving the benefits yet, right? It's not put in a trust fund for us later. It's going to current beneficiaries. So once you become a beneficiary, now that FICA money you start benefiting from. So does that FICA money now help pay for better insurance coverage than maybe the employer can cover? Or in what cases would a person decide not to keep employer coverage and go on to Medicare?
Well, the number one being the premium they might be paying for the employer coverage. If it's husband and wife and, $500, $600, $700 a month, well, then that's a logical decision to drop the group when Medicare itself is under $200 per person. And so that is something that, again, side by side with an agent to help them see the differences between the two. As far as the FICA taxes, as far as the Medicare premiums and all those, you're outside of my line of expertise on that piece. But it's a system that we've all put into or continue to put into, and when it's our turn, we enroll and we use those benefits.
Yeah, okay. Are there people who can get special benefits from Medicare? Special populations, people get more than others or even less than others from Medicare?
There's a couple of that I can think of. There are those that might be Medicare and Medicaid eligible. Now, that's two different terms. One is a federal level and the other is a state level, so Medicare and Medicaid. Those individuals may have some additional benefits that they can use because they come from different funds. Then there's also folks that may have what's considered a chronic condition. Those that are on Medicare with a chronic condition may also be eligible for additional benefits through some of the Medicare Advantage plans that are available in their area. And so meeting with an agent, we can help you decide which plan fits best for those individuals which company, making sure their doctors, their pharmacies, their prescriptions, everything is included in the plan that they're looking at.
Okay. So if I'm, you said chronic?
Some chronic conditions,
A chronic condition like arthritis,
more like diabetes,
diabetes.
heart conditions
right.
specifically.
And so those folks might qualify for additional benefits or plans that are designed for them,
That's correct.
right? And so some of their benefits might be richer because Medicare is, I guess, investing in those people, right, in their health.
Well, that the carrier is investing in those folks and their health.
Yeah, okay. And then there's people, you said Medicaid and Medicare. So Medicaid for low-income households, right?
Correct.
And those households, there are plans that are made for them.
That's correct.
Right.
It's called a dual special needs.
Okay, a dual special needs plan. Great. Those are people that probably need the extra attention and help, right? What about
So veterans are the VA. I guess the very first thing to explain about the Veterans Administration, it's somewhat of an island. So someone that might have veteran or VA benefits, they're not required to enroll in Medicare Part B. That's the very first thing. If they're going to get 100% of their care from the Veterans Administration near them, they're not required to get Part B. But the caution to that being, if they do not enroll in Part B and they decide later on to enroll in Part B for Medicare and use facilities and doctors outside of the VA, they will be assessed a late enrollment penalty. And so someone who's been a veteran, and we thank them for their service every day, that has not enrolled in Part B for several years and decides they want a traditional Medicare Advantage plan, they will be assessed the late enrollment penalty for not having Part B.
wow?
There, yes, it's kind of tricky. Now, there are some veterans out there that did opt in for A and B, and there are plans available to them specifically if they want to continue to get prescription coverage from the VA. And so those individual plans, I can't go into details, but I'd love to visit with those veterans and see what benefits they have specifically built for them.
So you can't go into details. My understanding is because there's a form people have to sign that Medicare requires before you explain the details of any particular insurance plan, right?
Very close. You're
Okay.
very close.
Yeah.
So Medicare requires this form to be signed. It is called a scope of appointment form. This form, it allows me to discuss details on the Medicare Advantage and prescription drug plans and health-related items, so long-term care, short-term care, dental, vision, hearing, correct? Those things. We are not allowed to discuss anything financial. So if it comes to retirement planning or, let's say, life insurance or final expense, I'm not allowed to talk about it at that particular time with that individual. So the scope of appointment is very important in an agent's, for lack of better wording, to make sure that we're compliant with CMS, Centers for Medicare and Medicaid Services.
I think I remember when they came out with this. This is 14 or so years ago. And my understanding is there were some guys out there, maybe some gals too, and they were selling people life insurance and Medicare Advantage plans that had no monthly payment cost, no zero premium, they call it, right? And the life insurance might be $50 a month. And they would sell these two items together as if they were one package. They would give the person the impression that they were buying a health insurance plan, a Medicare plan, that came with a life insurance benefit, and it was all $50. And they would do that so that the person would not change their plan. They'd stay on it, and their agent would continue receiving that revenue stream. That could put, not only was it a bold-faced lie, but it put consumers in an awkward position, right? What if they needed to change their plan? Their drug's no longer on a formulary. It doesn't fit them. There's some more attractive benefits they probably should switch to. They wouldn't do it because they might be scared they'd lose that life insurance. Well, I think Medicare got wind of that. And as they do, they solve a genuine problem with an awfully big hammer. So in this case, now we all got to sign this form every time we talk about those kinds of plans, right? So it prohibits someone from doing what those people were doing.
Sure.
So,
Packaging.
Packaging.
Yes.
Okay. Yeah.
Or a
Bait and switch. Yeah. Okay. Now, there are two kinds of so there's normal Medicare, right? So if I turn 65 and I have my A and B red, white, and blue card, it has my A benefits and it has my B benefits. But then there's all these other plans that are advertised. They interact with Medicare, a lot of which I think you've been talking about. There's two major kinds of plans. Can you talk about the differences between these plans?
Yes, absolutely. I'd love to. So everyone's familiar with the commercials on TV, and they're talking about Medicare Advantage plans. Medicare Advantage plans bundle parts A, B, and oftentimes D for prescription drugs into one plan. Those plans are they are under the banner of a carrier, and you'll see the commercials on TV. Oftentimes they have a zero to low premium, and they may offer additional benefits. The cautionary thing is the word free. So if anyone starts talking to you about free, you have to wonder exactly where the catch is. So Medicare Advantage plans, again, are bundled, A, B, and D oftentimes. The Medicare supplement plans are the other option. So a Medicare supplement is secondary to original Medicare. So Medicare would pay 80% of the cost. Once the annual deductible for Medicare is met, the supplement pays 100% at that point. Medicare supplement plans are secondary to Medicare. Again, Medicare is from coast to coast and border to border in any state in the United States. So as long as a doctor or provider hospital system accepts Medicare, original Medicare, then the supplement is accepted there as well. Not always the case with a Medicare Advantage plan. Oftentimes those are network type plans.
So with Medicare Advantage, it's the whole alphabet, right? And with a Medicare supplement, it just supplements the alphabet, A and B.
That's
right?
correct.
Medicare Advantage, you've got certain doctors, certain drugs, different moving parts, right? But Medicare supplement, you've got just about any doctor?
That accepts original Medicare. Yes.
Okay. And that's a good question. Do most doctors accept original Medicare? Do only a few?
You know, that's a great question. There are very limited doctors that don't accept. In my experience over the last 9 years I've been doing this, I've never run across a doctor that did not accept Medicare. And so it's almost hard to find one.
That makes sense. That's the population that needs the most medical care,
Correct.
typically, right? And right now that population is made up by the boomer generation, which is a large, important population. So most doctors are now under broad hospital systems that would absolutely want to take that. I remember there was a scare. I think it was put out by some talk shows maybe 7-8 years ago that fewer doctors were taking Medicare. And I believe those talk show people just misunderstood how this stuff works. Rather, if anything, more doctors are taking Medicare, which can get confused with Medicaid, which is what I think those guys were confusing. Medicaid dollars in some states that reimburse medical professionals for their services have decreased. So we've seen some medical professionals not take Medicaid. That's for people who are low income, and so that can decrease the Medicaid network and available doctors, but not Medicare. Medicare, as you say, you haven't found a doctor yet that doesn't accept Medicare.
I haven't found one yet.
That's good. Okay, so supplements, are they simpler, more complicated? Medicare Advantage? Give us a little more detail on the experience between those two for people. Because one costs more than another, right?
That's correct. That's correct. So a Medicare supplement plan, again, it's the opportunity to purchase an additional or gap coverage. So they call it the Medicare gap. So Medicare pays 80% of a bill, and you as a consumer would be responsible for the 20% left over. There is an annual deductible. It is not very much money. Once that annual deductible is met, then the Medicare supplement plan would pick up 100% of that 20 that's left over. So maybe that was a little confusing. Again, Medicare is an 80-20 plan. They pay 80%. You're responsible for 20. You have a Medicare supplement plan that pays the 20%. So how I make that determination when I meet with an individual.
So the supplement fills in the gap.
The supplement fills in the gap.
And Medicare Advantage takes over.
Medicare Advantage
It just gives you different gaps.
Medicare Advantage is a different plan altogether. Remember, it's an all-encompassing plan that has A, B, and D inside of it. Now, with those particular plans, you're going to have co-pays and co-insurance for almost everything you do. If you're having physical therapy, you're going to have a copay. If you go see a specialist, you have a copay. If you have labs and imaging and things, hospitalizations, you're going to have copay and co-insurance. So
a lot like employer coverage does.
Very similar to a group. Okay. Very similar to a group plan. That's correct. You have copays for everything. Where with a Medicare supplement plan, once you've met your deductible, the supplement pays 100% of all of the labs, the imaging, the doctor's visits, the everything that you, in hospitalizations, inpatient surgeries, everything that you might have done. So someone that might be health compromised, turning 65, using their open enrollment, can enroll in a Medicare supplement plan with zero health questions. They could be under treatment currently for some very serious conditions, and we would put them on a Medicare supplement plan, which would take care of the coverage of everything that they're being treated for. On a Medicare Advantage plan,
So the Medicare supplement plan, if I get a heart attack, I go to the hospital and I'm there for days, maybe a couple weeks for recovery. There's follow-up visits and there's all this stuff. You said it's all covered?
Yes. It's all meet your deductible and it's covered. That's correct. The annual deductible. Let's go even one step further. Let's say that you're currently under treatment for cancer and non-experimental treatments, and at that stage, meet the deductible. You've got Medicare as your primary, paying 80%. Meet the deductible, and the supplement pays 100% of the 20.
Nice.
Yes, I agree. That's why meeting with an agent that can help you make a decision based on which plan is most appropriate for the situation.
But for the convenience and the extra medical coverage, you do pay a higher cost. You pay a
monthly premium. That's correct.
Something like that, right?
It's for most people around the age 65. It's around about $100.
Oh, really?
So
okay.
Unfortunately, it is age attained, and so after the first couple of years, every birthday you're going to get a birthday card saying happy birthday, your premium's going up. So
okay.
I wish I could fix that, but I can't. But sometimes 100% health coverage is worth the premium.
Okay. And then Medicare Advantage, you typically pay nothing?
So Medicare Advantage plans have a zero to low premium. Depends on the company, the county, and the plan of which you choose. And 100% depends on where you live, what plans are available.
Okay, so some won't cost you anything per month, right? No monthly premium.
Correct. Or a low premium.
Or some be $20. Are there any that are like $50, $80?
Yes.
Oh,
there are.
Okay.
And so it just depends on, again, which county and what plans are available and which companies.
Because they can come and go. That's the other thing about Advantage, right? Medicare Advantage. The disadvantage, one of them, is that they can come and go each year, right? And they can come and go by county.
Correct.
Right? Okay.
Which I have seen.
Oh, absolutely. They've been around since, 2006? And we've seen a lot of that coming and going from counties. So if you're a more rural county, they're more likely to change. At least that's been my observation. Mm-hmm, yeah. Mm-hmm. If you're in a heavily metropolitan area, you're less likely to see someone just up and leave, right?
Correct.
At least a large carrier.
Right.
Yeah.
That's
yeah.
correct. Some of the larger carriers have expanded networks. I like to say that Medicare Advantage plans, you must stay inside their box of network providers and doctors. And so some of the larger carriers, though, have an expanded network. And you might be able to see a primary provider outside of the state if you're visiting, extended family or something like that. But with the Medicare supplement, it doesn't matter where you go and how long you stay there. You can find a primary in your area to help you with anything that you need. The Medicare supplement plans, even if there's a specialist in another state and you need a surgery, you can take your supplement with you. With the Medicare Advantage, not so much. That is not something that you could take advantage of.
Okay. By carrier, you mean insurance company.
Correct.
Right? Lots of insurance companies. How many are there? Are there lots, or are there just a few to choose from?
Well, there's lots.
Okay.
I can't even give you a list of how many insurance carriers there are across the United States.
Well, for Medicare insurance.
I don't know how many there are, to be honest with you. I have no idea how many carriers there are. And then again, it depends on which county and which state you live, how many there are that are available to an individual in that area. So I can even tell you where we live currently, how many are available in one county to another county.
Yeah, there's a lot. And then even when you think you've figured out who all of them are, there's
change.
some no-name small specialist insurance company with a specialist plan that nobody's ever heard of, and maybe two people are on in the entire county.
Right.
But they're right.
They're there.
Technically. You have your supplements, right, which cost a little bit more, have more coverage, and you can go see lots and lots of doctors, right? You don't have to worry about a network coming and going, right?
Right.
You have your Medicare Advantage, cost less, may have some extra copays, moving parts, right, and may change more from a year, but it costs less. Now, it has some extra perks, though, sometimes, right?
Sometimes, yes.
Sometimes they benefits to attract your membership. That's what they call it, right? They call
Yes.
it a membership when you enroll in their plan.
Yes. So it's not all encompassing. Not all plans offer the same additional benefits or ancillary benefits, but oftentimes, like the commercials on TV, they'll offer things like dental, vision, hearing. They may give you an over-the-counter allowance quarterly that you can spend for over-the-counter items. Self-explanatory. They may offer gym passes. They may offer transportation or recovery meals when you're in recovery. There's lots of little ancillary benefits that Medicare does not coverage. So original Medicare does not coverage dental, vision, and hearing, and that's a misconception with some individuals.
Okay, yeah, makes sense. And from what we hear, they made some of those benefits more attractive in the last few years, and it looks like due to some government changes that they may be rolled back some this year. We're about to find out more in the following weeks, right?
Yes.
About what to expect for
Yes.
2025 plans. Details yet to be released,
Yes.
right? Even to agents. Okay, you've brought up several times that people will see ads on TV, or they can get phone calls, right? They can get phone calls trying to solicit them to buy Medicare plans. You have visited with plenty of people in their homes who have bought some of those plans and had those experience or heard about them. What are your thoughts?
Well, I like to use the entice.
Okay.
Sometimes the skilled individual on the phone might entice someone to listen or peek their ears up just a little bit to listen to what they have to say, offering them things like free. This plan is free. It won't cost you anything. You get free dental. You get free this. I hesitate every day to use the word free. It is free. And so anyone that uses that word to entice someone to move to a different plan is not looking out for that individual, and their bit might be in their best interest. Probably one of the grossest things that I've was when an individual that I knew was on a Medicare supplement plan based on their health coverage needs. They were enticed to move to a Medicare Advantage plan using the word free and no premium. And that individual moved over to that plan. That caller or agent did not help them suspend or cancel their Medicare supplement plan, and they paid for it for a year. And it was never, ever used because the Advantage plan takes over and becomes primary. And then they also had out-of-pocket costs for all of their health coverage needs. And so it was like I said, it was the worst thing that I had come across, and there was no way that I could even get them back onto their Medicare, to get them off of the Medicare Advantage plan, we had to get them back onto a prescription drug plan and had to do that only during a specific time. And so it was a very difficult situation that the young lady, I'm going to call her young lady, was in.
But that's what you do. You help fix things.
Yes, I'm a fixer.
You're a fixer. All right. You connect the dots, and sometimes you got to move them around and make them fit right again. All right.
Well, and the biggest cautionary thing, too, is those commercials on TV are meant to attract your attention. That's what they're there for. Sometimes you'll identify with the actor that might be on TV, but remember, they're acting. So that's the one thing to remember. Number two, anytime you call those phone numbers on TV, that just leads you to a company that gathers your information and then forwards it on to agencies. And so you're going to suddenly get phone calls from, I don't know how many hundreds of people, all trying to get your attention and your business.
Yeah.
And so I would say that call a local agency, talk to a local agent, or find a local agent from or a friend or a family member, someone that they trust. Don't call the numbers on TV.
Yeah, or you call that number, or they call you, and you get put to a call center, right?
Yes.
And they have 2 or 3 plans out of the 19 that are probably actually available in your area, but their company gets compensated better, or those are their contracts, right? And so they have a few plans, and I actually interviewed a whole bunch of these people that used to be these call center salespeople, and they told me how it works. I've talked to some of their best people even that do anymore, and now they're repenting from their experience there. I think all of them felt very genuine, like they were actually trying to help a person, but they're not full-time professionals. Not I would call a full-time professional. Their hands are tied behind their back. Eventually they know that, and they barely take a bathroom break. Think of how people have complained about working at Amazon and places like that, right? That's what it feels like when I listen to these folks in the constraints they're under. So they'll help a person, but they're time constrained, and then they're never talking to that person again.
That's correct.
Some of them want to be able to, hey, I need to follow up on this person. I want to help them with this. We didn't complete our conversation, but they can't even allow to reach back out to the person most of the time.
No, it's very transactional.
Yeah.
It's very transactional. I meet with my clients face to face.
Yeah. So you can actually have time to talk it out, figure it out, go back. They know where you live, where you work. You know where they live, you work, right? Yeah. And then the folks who've bought it over the phone, right, if they have a prescription that didn't get done right, they didn't remember a doctor to bring up, it's done. I've heard of too many people. I get a little passionate about this subject, right? Because I know there's people in the Department of Insurance at some of these states that they'll also get worked up over this, because it's in some states, has been the number one cause of complaints is people who purchase their Medicare insurance coverage over the phone. Some of them didn't even know that they had their insurance cover changed.
Right.
There's all sorts of disclaimers and disclosures and everything the person's supposed to read, and they're recorded and all of that. And there's been a lot of new rules passed in a couple of years due to these guys. But they're still there. They're there in droves. In fact, I think it's picking up speed, because to them it's just more efficient. They can reach more people out rather than getting their car and driving to someone's home.
Well, and oftentimes I say that they're just part-timers. They only work during the annual election period. So that's, October 15th through December 7th. That's the only period in time that they work. And they're just constantly on the phones over and over and over, making phone calls, switching plans on people, never to talk to them ever again. So a lot of these telemarketing groups and so on, I just caution my clients every day, don't answer the phone, don't call the numbers on the TV, don't do any of those things. You have a question, you call me directly. If I'm not available, call the office. Someone there can answer your question.
They have your cell phone.
They have my cell phone, absolutely.
Yeah. Okay. And this isn't meant to be a commercial for it, but
I appreciate that.
I have received calls and messages from your clients. Do you remember the earthquakes that happened? Was it been 2 or 3 years? Feels like yesterday.
Here?
We had some earthquakes.
Here.
Right here in Salt Lake.
Yes, of course,
Yeah.
the earthquakes.
Some of your clients called from an hour or two out of town and asked if you were all right, knowing you lived in Salt Lake from Heber beyond, right?
Right.
So you must do okay.
I must do all right.
You do all right. All right. Well, for spending this time with us.
Absolutely.
I know you actually have a client who just got here in the office, and we'll let you go. But thanks a lot, Tammy.
All right. Thank you, Larry. I appreciate the opportunity.